Hey guys, thanks for bearing with me through my little YouTube hiatus. During the whole molar pregnancy stuff, I had nothing positive to say. I was just waiting for things to be over and trying to ignore the whole molar pregnancy topic, to be honest. So, anyways, today I have my follow-up appointment 6 weeks past the surgery, and things are going well. So I thought I'd tell you about what's been going on. This video will be helpful for somebody who has been diagnosed with a molar pregnancy or can relate, but otherwise you might not find it helpful, so feel free to not watch the video. Or if you're curious, go for it. So I did have a confirmed complete molar pregnancy. I need to learn more about that, but my understanding is that it means, yes, it was a molar pregnancy. Yes, there was never an embryo, no trace of a baby. Some kind of issue with the egg or the sperm had happened. I had the surgery in mid-March, and I went for weekly blood work every week. My HCG was around 440,000 at the time of my surgery, and now 6 weeks post-surgery, it's at 35. So 35 is nice and low. I still need to go for a few more blood tests just to confirm that the numbers hit and stay below 0. I am very fearful, I'd say phobic of needles, so I'll probably talk about that experience in a separate video. But in short, I did find that using an EMLA patch, which is a numbing cream patch, an EMLA patch really helped me to go to the blood work and have things go well. I did have one scare during the course of the molar pregnancy aftermath. My doctor said that I shouldn't have any blood clotting, and I did have blood clotting on April 12th this month. And it was on the weekend, 2 days before I had a flight, so I called my doctor and my specialist and called the on-calls, and they were able to get me in for an ultrasound, and the ultrasound revealed that there's nothing abnormal, everything looks great. So my doctors are very happy with how things have gone after the surgery. It turns out that the blood clotting I had is what we're calling like my first period after the surgery. It was only like 5 weeks and a few days after the surgery, and typically you should not have a period until at least 6 weeks past the surgery. So mine, they're calling this a period. It was definitely not a period. It was like a little bit of blood, like a couple blood clots and like a little bit of blood, like a very, very light period for like a day and a half. And that's it. A bit of spotting, and my doctor explained that as because my body had just had all the endometrial lining scraped out, essentially, there was not a whole lot of buildup that had time to develop. So even though it was very, very light, both doctors said we're going to call it the first period because nothing else abnormal is going on. So yeah, over the next month, I'm just waiting for the numbers to officially hit 0 for the beta HCG. My doctor has suggested that I take folic acid. You hear about folic acid being important when you're pregnant, but she said in the time you're trying to conceive, just that there have been studies that have shown that that vitamin deficiency with folic acid is possibly connected to issues with a molar pregnancy. So she has suggested that for the duration of the time that Joe and I are trying to conceive and through my pregnancy, that I take 4 to 5 milligrams of folic acid. Don't quote me on that. Definitely talk to your own doctor before you take anything, but that's what I will be doing. Other than that, I am just taking a multivitamin every day. My doctor said to make sure I take a multivitamin and folic acid, and then I'm good. Yeah, today is the first day in the past 6 weeks that I felt like talking about the molar pregnancy with YouTube. I've pretty much just left this channel, and I do apologize for that. Like, I know I have friends on here that I haven't been watching your things. I've just kind of checked out completely. But it is a little hard, like for me to have been pregnant and then to see everyone else's pregnancy progressing. It's just not exactly how I want to spend my time, unfortunately. So I do apologize for checking out, but I'm back now. And as far as trying to conceive goes, the old rule of thumb used to be that if you had a molar pregnancy, that you should wait a year before you try to conceive, just to make sure that that nothing, like metastasizes, or that HCG doesn't cause cell growth in other areas of your body. But the new way of thinking is that if your HCG hits 0, there's not really a lot of reason to wait a long time. So the plan was going to be Joe and I were going to wait until September to try and conceive, but now both my doctor and the specialist have both said that once the HCG is at 0, I can wait to make sure I have a healthy cycle, like wait till I have my period first, and just to know that things are okay. But after that, they've kind of given us the green light to go ahead, so that's really exciting. We could be trying to conceive again as early as, I guess, June. Joe and I had been trying to conceive for about 6 or 7 months before the Molar pregnancy. So yeah, we have to talk about what we're going to do as far as IVF goes and trying to conceive and all that. But we will be back on the bandwagon shortly and making more videos. This video is already 6 minutes long, so I'm going to wrap it up here. But hi guys, I miss you, and I'll talk to y'all soon.